Friends, did you ever sit down to do something, having an idea that it would be a certain way, and then when it was over, it was way different than you expected? If that has happened to you, then you know what I felt like when I got done recording this episode. Hello, everyone, and welcome to episode 481 of the Juicebox Podcast. If I seem like I'm not as enthusiastic as I usually am, I'm doing something a little differently this week. I'm getting ready to go away with my son for a few days, so I'm editing a ton of episodes and getting them ready to, they're going to go up automatically because I won't be here. And I'm having trouble, bringing the zoom for every one of these intros and outros. So I'm okay. Anyway, this episode is really cool. It's Kari. She's the mom of a type 1. She's a veterinarian. She's the person who handles all the type 1 animals in her practice. And somewhere in this episode, she told me something that I didn't expect to hear. And it made it really a full conversation. Much more than I expected. I really appreciated it. Please remember while you're listening that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan or becoming bold with insulin. This show is sponsored today by the glucagon that my daughter carries, Gvoke HypoPen. Find out more at gvokeglucagon.com/juicebox. The episode is also sponsored by the Contour Next One blood glucose meter. It is, in fact, the most accurate, easy to use, easy to carry, easy to read blood glucose meter that I have ever personally held, used, or talked about. I am not kidding. contournext.com/juicebox. And I'll tell you this too. It's a really great website. It's not, when you get on a website, you're like, who made this? Did the person who made this website, had they ever been on the internet? You ever have that feeling? You will not have that feeling at contournext.com/juicebox. I'm holding up my hand like they do in court because I am telling the truth, the whole truth, and nothing but the truth.
I am Kari. I'm a veterinarian and just general practitioner, and I see a lot of cases, and I tend to get a lot of our diabetics because obviously we all know it's a pretty complex disease on the human side and equally complex, but a bit different on the animal side. So a lot of the other doctors I work with are sometimes intimidated or frustrated with the cases. So I see a lot of them.
And what's your connection personally to diabetes?
My daughter is 14 and she was diagnosed at age 7 with type 1.
Okay. So we're not going to say your daughter's name. Is that right?
Yep. Correct.
We'll just say your daughter. That's how I'll handle it.
Okay.
How old was your daughter when she was, not how old, excuse me, but what was the care like when she was diagnosed? 7 years ago seems like you might have been pump CGM time.
Yeah. So when she was diagnosed, it was 2014, and we got the Dexcom a couple months in, and it was not in the cloud. And then somewhere along the way in our first 4 or 6 months, we got the super expensive little base station so that when she was sleeping, the data would get sent to me, my phone, whatnot. And that was super exciting. And then seemed like shortly after that, it all just ramped up into total the app and the receiver and the cloud and all that. And so then she went on a pump probably 6 months after diagnosis.
Gotcha.
We started with animlas and moved to Medtronic and now T-Slim, and I feel like we've experienced a lot of the technology.
We're running the gamut on the pumps. One thing, I think either your hair or jewelry might be brushing the phone.
Okay.
I know that sounds crazy, but and I have a Dexcom cradle right in front of me.
Do you?
Of all the old stuff that I've tossed that, becomes, unnecessary as the years go by, I can't seem to get rid of this one thing. Because it worked out so oddly that, I mean, Dexcom clearly produced these cradles because they thought it was going to take longer than it did to get that next device approved.
Yeah. I feel like I remember it being pricey, like, I don't know, 100, 200, 300, I don't know. Right. And then within months it was useless because things were better. But I mean, it was worth it while I had it, I guess.
I imagine them all over desks at Dexcom with business cards in them. So that's how I say it in my head. But yeah, I mean, for people who don't go back that far, it was absolutely insane, right? This little thing came out and you would take your Dexcom receiver, slide it into it, and somehow then attach it to the cloud and somebody could follow you. It was such a big deal. Just such a big deal. And we could only use it really at night, right? Like it was kind of by the bedside feeling.
Yeah.
Is that how you remember?
It was too complicated to like get it to school, and we had our teachers trained to monitor, and so it was just by our bed. But it was such a great thing to be able to just sleep and wait for the alarms. And then, Do
you wonder now, most people probably don't even know there's a receiver. They just use their phone, I would imagine.
Yeah.
That's fascinating. It really is. And then the part that, of course, was both kind of frustrating if you paid for it and otherwise is that the new receiver that kind of had the chip built into it that could go to the cloud. Oh my God, it couldn't have been 3 months maybe, and it was available.
Yeah, that's what I remember. It was super quick. I'm like, well, that was a big investment for a couple months. But oh well.
I totally remember that. So in that time, I guess I want to know a little bit about your ideas around management. Like, I mean, 7's pretty young. I imagine you were pretty involved with your daughter.
Yeah, for sure. And because I am medical, I mean, I just jumped right in. I totally understood it. And she was so young. And it was first day of summer break. So I ended up spending a lot of days that summer going on her little field trips, the summer camp field trips. And I just hardly let her out of my sight. The manager or whatnot at the daycare she was with learned diabetes. No one there had ever had it in their recollection in recent years. So she took it on and helped me out quite a bit. But any field trip, dosing for carbs, this and that, I was always there. So, and then we were fortunate enough when she entered 2nd grade, we had the most amazing teacher ever of all my kids' years at school. And she took it on like a second mother, and she was amazing. So it went pretty well, all things considered, as much as pretty well could be.
Yeah, no kidding. You could expect in something like this. What did you take to it pretty well, or did you find yourself wishing she had kennel cough because that you understand?
I mean it was different. I mean, it's managed very differently in animals and humans. So, but I understood all the science behind it so easily, and but yeah, it's way different. I feel like we manage animals like we did 20 years ago. I remember a type 1 diabetic, kind of a friend of a friend back when I was in college, and they were doing, twice a day shots and carrying a cooler. I remember going to Cedar Point and they had the big lunch cooler and, the glucometer and no remote, no CGMs, and he had multiple seizures, and I just felt like it was so poorly managed 20 years ago compared to humans today. And unfortunately, that's kind of where we are with animals, not because we're behind the curve, but because it's just not super realistic to do all the intense carb counting and CGMs and all that in all the animals.
You just really made me focus on the idea that back then with regular and MPH and those kinds of insulins, that probably, I wonder if you spoke to a doctor behind the scenes back then, if they were just thinking, oh, well, this person's pancreas stopped working, so we're just going to do our best to keep them alive for as long as we can until stuff starts going wrong. Because that's the vibe with the dogs, right? And the animals.
Yeah, pretty much. I mean, we do the best we can, twice a day dosing. And we have started playing, some of us have started playing around with the Freestyle Libre or whatnot. And I've only had one client religiously try it, but I keep begging clients to try. But yeah, I mean, we just, for lack of better terms, we somewhat wing it. I don't have owners do blood sugars at home very often because they get too worked up on, a blood sugar of 300. They all of a sudden want to increase insulin, but we have a much wider curve on our dogs and cats than some well-controlled humans, not necessarily my daughter these days with hormones, but they can fluctuate 100 to 300 and be pretty acceptable. We hardly blink an eye if the average is okay. So we don't micromanage it as much. We just kind of do the best we can and educate the owners. But obviously it's very overwhelming for many of them. And we try to dumb it down almost to, reduce their stress and yet still do the best we can for the animal. So, yeah.
Kari, that's, it sounds sad, I guess is the word I want. The understanding that there's this thing, but I guess that really is medicine in general though, right? Isn't it? Like we're getting better and better at it as time moves forward, but a lot of it is maintenance. And when you mean maintenance trying to stave off something, whether it be a problem or the end or whatever it is. You're just trying to slow the progression to this thing.
Yes.
And can you tell owners of pets that, or is that not something you kind of freely share?
I'm always very optimistic that, we can give them a relatively normal life. The hardest part probably is some of these dogs are just picky eaters, and to have an owner at home kind of treating blindly without regular blood sugar checks, blood glucose checks, and all of a sudden the dog doesn't want to eat breakfast. What do they do? And, to try to give partial doses and to educate them on all that. So I try to just encourage them that, we're going to do our best to give them a pretty happy, healthy life. And one of the biggest fears is the needles. And even the most scared clients realize the needle's no big deal. I try not to overload them with all the heavy potential negative stuff, but, a large portion of the dogs develop cataracts. So I do tell them that right off the bat, dogs more than cats. And, I tell them they're going to be frequent visits back to see me, and it's not cheap. It's paying, full price for insulin and, the blood tests, without, most of them don't have insurance. And so I kind of prep them that it's a little bit of an expensive disease, but you can do it, and they're going to feel great. And, there may be complications down the road. There may be shortened lifespan, but we'll deal with each one as it comes. And I try to keep things as light as I can, but still, this is something to be taken seriously. But we can do this together. We're a team. Call me anytime.
Yeah. And try to make them feel a part of the process of doing a good job. I imagine. Yeah. How do you get a cat or dog to drink a juice box? That's all I can think while you're talking.
Yeah. So our go-to is like Karo syrup or maple syrup on the gums, that sort of thing. And call us if they're not coming around in the 5-10 minutes.
It's fun. It's funny how the problems are mimicking both sides. Like I've 2 dogs, and one of them's older. And there are some mornings, the process, the morning goes exactly the way it goes every time. And he comes back in from out back and he's like, oh, the man put the food down. And he comes over and he eats the food. And some days he looks at it and goes, not now. And then he goes over and lays back down, which he never did when he was younger. And I'm trying to imagine talking a dog into eating, I guess is the thing.
Yeah.
I'm trying to wrap my head around. And it's making me think back to when my daughter was young as well. So
it's hard when they're picky eaters. And, a lot of these dogs, like schnauzers, are notoriously type 1s and, or, diabetics. Dogs are more often type 1 and cats more often type 2, interestingly enough. But, these little dogs are not always big eaters. Labs are prone to it. also, and that usually goes well because they eat anything you give them. But yeah, some of these little ones, one of my most intensive cases is a little Chihuahua, and Elvis. He's an old man, and he's had cataract surgery and all kinds of stuff. She's the one actually who tried the CGM, the Libre. And so she's mastered it because she is all in, as most of us are parents to type 1. So we're all in and we're micromanaging. She lives her life to manage this dog's diabetes, I swear. So what's my point? Oh, he's not the best eater. So she's, always trying to finagle what he eats. And she's well aware of all the complexities of carb counts that I don't overwhelm most of my clients with. So she knows like what's high carbs, low carbs, and how that affects his insulin needs. And, but yeah, when they're not good eaters, it's hard. Wow. So it's a battle for them for sure.
So I'm sorry, you've got me off kilter a little bit, because I literally am just picturing someone on their knees with a handful of kibble going, just have 5 of them. Just please eat 5. I gave you your insulin already. How long does it take the dogs and cats to get used to getting a needle?
Honestly, they don't notice it.
Okay.
They do great. So I have the owners, if possible, I have them feed twice a day, dose twice a day. And I tell them, and every vet does it differently. And I've tried to coach my clinic vets to kind of do it similar to me, because there's such differences. I've seen some vets say, "Oh, dose them an hour later," and I use the food as a distraction. Once it looks like they're eating most of their food, just give the full dose. And most owners are shocked that the dogs never, and cats too, never even act like they feel it. Wow. So they do really well, and it's done a little differently. We don't use the pen needles. We actually tent the skin and kind of angle it 45 degrees with a more traditional insulin syringe. Although I had one schnauzer that was vicious to the owner, and they literally had to kind of just dart the dog as it walked by. His name was Lucky. You should never name your animals Lucky, because it never works. It's always the opposite. But I know we'll get back to this in a second, but it puts you in the position of tending to a dog who's passing away and having to turn to somebody who loves it and goes and tell them, Lucky's going to die. Luckies they're never lucky ever. Oh, they're the hit by cars. They're the bad diseases. But yeah, this dog, she's the only patient in 20 years of practice that I've ever had use the little pen needles, and like literally just dart him as he walks by.
That's really great.
And it worked. She kept him alive for quite a while. But yeah, they don't notice the needles. Honestly, they do so well.
Yeah.
The owners are more freaked out, but we demo it.
They can kind of see it's not a big deal.
Yeah, we have them give them some saline as a practice, once, twice, 3 times, whatever they're comfortable with. And they go off on their own. And almost every single owner is shocked how easy it ends up to actually inject to them and the pet. So
I have a question that you said that you when you brought up type 2, it made me think. So how many years do I have to go back into veterinary medicine before no one would ever consider giving a pet insulin?
Yeah, good question. My whole 20 years, we've all been on board.
Okay.
I don't know. I still have clients that occasionally request euthanasia when they're diagnosed. And it just breaks my heart because it's close to home. And I've probably given in and done 2 maybe in recent years, but I do everything I can to talk them out of it. And I don't know at what point, it progressed through to a little more effective treatment in the animals. I would assume it's been quite a while. I mean, if the insulin's been out.
Do you imagine that, and this is me guessing, so if I'm wrong, you stop me, but do you imagine that people who are able to seek frequent and regular care through a veterinarian for a dog are in a better financial place than other people? And does that not make us believe that people who can't afford it still have pets?
So yes and no.
Okay.
Funny enough, my practice is like the edge of a big city. And so we pull in clients from the wealthy suburbs, inner city. I have learned through the years, you cannot judge where they live, what car they drive for anything. We have, clients with the fancy cars. I mean, no offense to anyone listening, but they're just absolutely appalled that I asked them to buy $110 Lantus pen. We use the pens in cats as a vial, basically. So they don't have to buy a $380 vial of Lantus. To use 2 units twice a day. We buy packages of the pens and break them up and sell them for 110. And people are just absolutely upset either with us or with, insulin, crazy pharmaceuticals in general. And then we have, people driving beaters and just not looking as well to do, and they don't blink an eye and they'll do it. So I've learned long ago, like, not to prejudge anyone. You lay it out there and
let them decide.
Yeah.
So do people ever, like, how harsh does it get? Like you said, they has anyone ever said to you, you want me to spend $110 on something that cost me $20? Like, does that ever get that harsh, or do they not say that to you?
So what do you mean? The 110 that cost me $20?
I think I think there are some people that don't know. I think there are some people that don't see a cat. I think they see it as a belonging sometimes and not a animal. Yes. Does that make sense? And now you're suddenly like, here, let's spend a lot of money to medicate something that you paid $20 for at some point. Like that.
Oh, I see what you mean. Yeah, absolutely. And again, that goes across the whole range. Like, wonderful parents, they shoo the kids out of the room. They're like, we're not doing this. We'll go get them another cat next month, or, whatever. Right. And vice versa. It's people just range. I've had so many people say, oh, I grew up on the farm, or, we never treated our cats and dogs. They lived to be 18 and, we don't need to do this. And,
right.
Again, just recommend what's medically best. But veterinary medicine has evolved to be more intensive and more high quality. We're actually building a new building right now, and we have someone trying to sell us on a CT scanner because that's the norm for dentistry. It's better. We thought we were doing great because we had dental x-rays, but now the norm is to CT the jaw. And it's just, things are evolving so much, just better care, better technology. And as a result, often higher bills, and people do it. They love these pets, and, most of them will do whatever it takes. They may complain, but my practice is always pretty good at kind of giving them options. Diabetes probably isn't a good example because there's not a lot of options. You treat it or you don't. But, right. If the dog's vomiting and it's prone to foreign bodies, but you're pretty sure it didn't get into the sacks today, if you want to just treat for a virus and wait for an x-ray, that's your choice. Or you can spend, $180 for x-rays and see if there's a sac in its stomach. So we kind of give plan A, plan B, and so many people go with the full workup, and I mean, they want to take care of their pets.
Yeah, it's lovely. Really, I'm trying to decide what the number is for me not to take care of my kid. Like, I'm like, what number would someone have to spit out before I went, I don't like him that much? I'm sure there isn't one, but what I'm thinking too is that you don't get into veterinary medicine like by mistake, right? Like you weren't like trying to decide whether or not to be an accountant or a veterinarian. This was a calling for you, I would imagine. This isn't much of a cliffhanger. I mean, Kari's going to say that veterinary medicine was a calling. I mean, can you imagine if she didn't? Can you imagine if she was just like, oh, no, I hate animals? That is not what happens. But anyway, that's neither here nor there. You'll find out all about that in a second. For now, I need you to know this. Gvoke HypoPen has no visible needle and is the first pre-mixed auto-injector of glucagon for very low blood sugar in adults and kids with diabetes, ages 2 and above. Not only is Gvoke HypoPen simple to administer, but it's simple to learn more about. All you have to do is go to gvokeglucagon.com/juicebox. Gvoke shouldn't be used in patients with insulinoma or pheochromocytoma. Visit gvokeglucagon.com/risk. I wish you all could have been here the day I learned to say pheochromocytoma. It was hilarious. Anyway, I need you to go to contournext.com/juicebox. Why are you going to do that? Well, it's easy. When you get there, you're going to find a blood glucose meter that is accurate. You understand? It's easy to use, easy to hold, easy to read, has a nice bright light for nighttime viewing, and it has second chance test strips. Second chance is exactly what it sounds like. You take a chance, dip it in the blood, right? What other ad in the world do you hear dip it in the blood as part of the words? You put the test strip in the blood and say you don't get enough. Uh-oh, that was your first chance. Now you get a second chance to go back and try it again without interfering with the quality of the test. And you don't ruin a strip. Not bad, huh? Plus the thing's easy to use. I love it. I mean, as much as you can love a blood glucose meter, I love this one. That's an accurate and honest statement from me. I mean, like if you said to me, Scott, what do you love more? Sunny days or blood glucose meters? I got a blood glucose meter's good. I could do with or without the sun. But I mean, if it got down to my family and you're like, Scott, here's your wife and a blood glucose meter, I'm going to go with Kelly. That's not the point. The point is, I love this meter, and you may too. You may also love a lot of the things going on at contournext.com/juicebox. So head over and find out. They have a test strip savings program. A lot is going on. It's a really, I mentioned at the beginning of the episode, I don't mean to jump around in the middle of the ad. I'm sure right now the people at Contour are like, could you stay on topic, buddy? We're paying you here. But I am. It's a great website. It gets really well laid out. It's easy to find, and there's a ton of information on it that's not overwhelming or confusing. It's worth your time. contournext.com/juicebox. I got a bit of time left here in the music, so let me just say this. Find me on Instagram. Find me on Facebook. I'm Bold with Insulin on Facebook. I'm Juicebox Podcast on Instagram. And the private Facebook group where there are now 11,000 users. A lot of them active every day. It's a jumping Facebook group full of cool people talking about type 1 diabetes. It's called Juicebox Podcast, Type 1 Diabetes. That's it. You go there and you chat with other people just like you, other listeners. 100% free. Nothing to do. Just, answer a couple of questions, make sure you're not a robot or somebody trying to sell t-shirts or other scams. That seems to be a big thing in the diabetes community. People come in and they go, oh, I have diabetes and look at my brand new t-shirt. Isn't it amazing? And they just take a picture. I'm going to keep talking here for a second because this really pisses me off. So I'm just going to take a second to share it with you. And I mean, pisses me off is harsh. I don't know if it pisses me off. It's a well done spam. Do you know what I mean? So somebody takes a picture of themselves and they're like, I have diabetes and I know how hard it is. And it is hard. And my shirt says that I'm tough or whatever. I don't know how the shirt says. And then they don't like pimp it. They don't put a link up, right? They're not like me. They're not like juiceboxpodcast.com. They don't do anything. They wait for someone to say, oh, I love your shirt. Where did you get it? And then they're like, let me just give you this link, which goes to their store. These people don't have diabetes. They're preying on you. They're trying to sell you diabetes t-shirts. Now, if people want to sell you a diabetes t-shirt, they should just tell you, I'm selling you a diabetes t-shirt or I'm selling you another t-shirt. That's fine with me. I'm all about capitalism. I'm good with that. But don't try to trick people. Don't try to make it look like it's one thing when it's not. I don't like that. So anyway, I try to keep those people out. And I do a pretty good job of it. So don't be afraid to check out the Facebook page. Well, this was long-winded, wasn't it? Let's get back to Kari. This was a calling for you, I would imagine.
Yeah, I wanted to be a vet my whole life. And, of course, growing up, all your friends do too. We all did at one point, right? Probably. But they drifted away to other things. And I was a senior in high school or junior, whatever, applying to undergrad. I'm like, I've never thought about anything else. Maybe I should. So I looked into, of all things, architecture and special ed. And I thought, well, those are cool careers, but no, I want to be a vet. So And then went on from there. And some people, because vet school is kind of hard to get in, depending on the school, the average is 1 out of 10 applicants. So some people, after not getting in, move on to like the human side, because I don't know if it's good or bad, but it's easier to get into med school. But I couldn't do humans. Humans are kind of gross medically, and and luckily I got in, so I didn't have to think about what else to do or how many times would I apply. I got on first try by some miracle, and here I am.
I have to say that the first time I saw a veterinarian express my dog's anal glands, I thought, she really loves this. Like, this is her calling. There's no way she's just doing this for money. Like, there just can't be. you know, like, I don't imagine.
There's some gross parts. Luckily, we're pretty well staffed, so we delegate out to your skill level and what you're trained at. So my unfortunate technicians get to do most of the anal glands. Unless they're busy and I don't want to wait, then I'll do it. But
no, I was asking because, I mean, I would think that a person who, I'm guessing, loves animals as much as you, who went into a profession to keep them healthy, that when someone says to you, hey, I don't want to give this thing insulin, let's just let it die, or can you put it to sleep? I don't imagine that you see much of a difference between that and if I were to come up to you and tell you, you know, we're not going to bother with your daughter, she's a lot of work. Like, I don't think you.
Yes.
I would. Am I right about that?
Yes. Okay. Yeah, I agree. Yeah. And you know, my partners, my associates, I think they accept that request easier than me. I'm the only one with a type 1 family member. But because it is pricey and it's high stress and it's high maintenance, and you know, so when an owner is just not willing, you know, I find we are all in it to help the animals, but we also have a lot of really emotional, hard things every day, of people who don't want to treat something, or people who you know, think it's a charity and their dog was hit by a car and they need free surgery. You know, it's a very emotionally draining career. It's not all petting cute dogs and cats and saving their lives every day. There's a lot of human emotion and ranges of quality of care and willingness to be compliant, and, you know, a lot of difficult stuff with like guilt trips or blame or this or that. So anyway, I find the other doctors, you know, if they diagnose a diabetic and the owner is just not willing, they sadly agree, versus I put my foot down and like, absolutely not. Am I euthanizing your dog? I cannot. We are going to treat it. We're going to find a way.
I have to tell you, I did not want this to turn into a therapy session for you, but the whole time this is where I've been heading. So just so you know, because I really felt like, how is it possible that she can't, like, I didn't think you could disconnect that feeling from your personal life. And like, you know what I mean? Like, I just don't know how. If, I mean, I've been a pet owner most of my life, and I can't fathom how somebody would just be like, oh, it's sick. Oh, forget it. Like, I don't understand that, but I'm also not, I don't know how to put this. Like, I'm not a crazy pet owner. Do you know what I mean?
Yeah.
Like I think there's a line, like you're saying, like, I kind of believe if my dog got hit by a car and I brought him in and he looked really bad and you said, this is going to cost $10,000 and he's probably going to die, I might be like, ooh, you know what I mean? Like, that probably would hit me, but that would be because I feel like that would be because of the money if I couldn't afford it. I think it's just a weird thing to look inside yourself to try to decide, you know?
Yeah. Yeah. It's hard. I mean, it's a daily battle, and it's hard. It's hard on owners too. Like you said, you love your dog. Can you do 10 grand and there's a guarded prognosis? And I mean, it's hard on them. And most of them are very, understanding of the situation we're put in, and we come to a decision together. But there's a lot of tough points where, you know, they don't agree with, you know, our estimate, or they feel that this is an animal and we're in it to help animals. We're obligated to do whatever it takes. And why are we trying to make a fortune? And, you know, so there's hard stuff, and there's owners, you know, that just don't, understand why it's such a big deal that their dog has a tumor that's probably malignant. The sooner we get it off, the more chance that we can prevent fatal outcomes. And now they're just going to watch it. And, so we have to go with that. That's their choice. And we have to go home at night and let it go. And it's a hard thing sometimes, but I've learned through the years, and this may sound cold, but I love these animals. I love the science, but I have emotionally distanced myself a little bit from the bond that these animals have with their owners and the owners' lives. And I try to be very thorough, very friendly, very helpful, but I try not to get too connected or too bonded to some of these pets. And there's always those ones that sneak through, and when they die or when they're sick, I cry like it's my own child. But I think that's what's hard in our profession. We actually have a very high suicide rate. We're ranked the highest in all professions, apparently. And it's like 3 times what an average American is. And it's a very emotionally difficult career because of all that stuff. So again, it may sound cold, but I still absolutely love my job. And I find it's because I enjoy the animals, I enjoy the science, but I try not to get too attached to each individual patient, because you can't handle it. You can't keep your chin up and deal with all these tough decisions and financial limitations. And, it's tough. So I do the best I can, but again, certain patients get through and certain causes like diabetes gets through. And I am absolutely attached to every diabetic patient I have. And
Are you the diabetes doctor? Like, is it that simple? Like, you just hear calls from other rooms like, Kari, this one's yours?
Yeah, pretty much. Yeah. Yeah, because endocrinology is super tough. I mean, it was my hardest class in vet school. And it's complex. All the hormones interact with each other and everything else in between. And, as general practitioners, we treat everything, and we treat minimum of 2 species, cats and dogs, in, small animal practice. I do some exotics too, but, you have to know everything possible about the heart and the kidneys and all the endocrinology and musculoskeletal, and we do surgery and neurology. And so, these doctors who aren't living type 1, like I do with my daughter, are like, okay, I have this diabetic dog, the dose is this, and oops, I don't understand why his blood sugar's not well controlled. Kari, help.
Please come help me.
Right.
I'm starting to wonder if everybody's endo doesn't feel that way. If they're just
that's true.
Just like, I wish I could call someone else to come in here and help you. Are there any odd animals that get diabetes? Like, I assume not frequently, but what's the weirdest one you've seen?
I've diagnosed a couple guinea pigs. And other than that, I don't know. I mean, I'm assuming every animal can, but we mainly just do cats and dogs. And, back in vet school, we had to learn 6 species. The exotics were kind of separate from that, but, cows and goats and horse and sheep and cows, goats, horse, sheep. Yeah, cats, dogs. So those are the 6. And I remember some endocrinology from the rest of them, but not a lot.
I have to be honest with you, and I'm embarrassed. I can't believe I'm going to admit this. People don't get a podcast, because if you don't tell people the truth, they won't listen. And you said guinea pig, and I thought, well, there's my line. I found it. I really did. I was like, yeah, okay. I don't know that I could buy hundreds of dollars worth of insulin for a guinea pig. I think you may have found my line. I'm really not just embarrassed. I'm ashamed, and yet I'm saying it. So
no, it's fine. Yeah, and that's the thing, because I do see exotics. I have a lot more clients probably that. What am I saying? I mean, the ones that will bring a guinea pig in with a urinary issue and actually pay surgery to remove a bladder stone, it's shocking. But think about how many households have hamsters and gerbils and guinea pigs and rabbits. And I don't see 99% of those. Right. I mean, they all stay home, and when they're sick, they the poor little kid holds them and cries and they die.
Yeah.
But, the ones that come in, those owners will do anything.
Do you think this might be
because,
I'm so sorry. I cut you off.
No, you're fine, because they do make the effort to come to the vet to begin with versus most owners do not. And that's understandable. I mean, that's part of our job. I'm not going to make someone feel bad because they don't choose to do something. Unless it's diabetes, then I will make you feel bad.
Then you will, absolutely. So if any of you out there have a diabetic hamster or gerbil and you're not getting it treated, this person is not going to let you off the hook, just so you know. Did you feel this way prior to your daughter's diagnosis? How was it different prior to that?
As far as like veterinary medicine and the overall outlook?
I mean, with the diabetes specifically in animals, like 10 years ago, if somebody's dog had type 1 and they were like, I don't want to do this, were you just like, all right, or like, do you know what I mean?
No, because I've always been, so I have this theory that vets get into veterinary medicine for one of three reasons. And I think we all start off with a high compassion for animals, but almost equally common is the interest in science. And the third is money, but believe it or not, we are a very low paid profession compared to other doctorate degrees. And that goes all the way through our entire staff, technicians, everyone. I mean, when I graduated, I got off track, but when I graduated vet school, the average starting salary was $45,000. At Ohio State, there was 4 doctorate programs, and the next highest, I think, was dentistry or whatever it was 90. So that gives you an example. It's a very low paid profession. So a lot of people feel we get into it for the money, but we don't make awesome money compared to human MDs and whatnot. So anyway, back to my philosophy on this. A lot of us are in it for the science too. So I definitely feel like, I'm equally compassionate for these animals and science. So I always loved like the internal medicine stuff. I actually had myself all set up to kind of become a specialist. I was hoping for internal medicine. There's 2 tracks to be a specialist in veterinary medicine. You can do the residencies, and work at the vet schools or the referral hospitals, or you can kind of do an in-clinic. You almost self-study for boards, and you have to have a couple mentors that are specialists. You have to present case studies and stuff like that. So I always loved all the science, and I was definitely not an expert on diabetes, but I enjoyed all of that stuff a lot. So I had my timeline, I had my mentors, I had one of my 2 case studies to apply, all that stuff set up. And I loved school. I missed learning. I was super excited. Had my books ordered.
You are exactly like my wife, by the way. Like this is how, my wife is a biology major, and she very much was on the way to going to medical school when some things in her life kind of threw her sideways. But she talks about science and the medicine, and she also thinks people are icky. I don't think she ever would have been a doctor who would have practiced on somebody.
Just can't do it. But I was all set, and then my daughter was diagnosed, and it just took the wind out of my sails. So I still claim to be kind of the nerd of the group. I kind of have a very informal title of medical director. I love implementing new things and learning new things. I'm the one who reads every magazine that comes through. I'm the one who actually enjoys going to CE, continuing education. So I love all that stuff, but I don't predict I'll ever have the energy to go through the program.
If I said to you, money wasn't a necessity and you could do whatever you want right now, you'd go back to school.
Oh, absolutely.
Yeah. I know your type. Okay.
But I don't want another profession. So I would just have to be a specialist. And I don't have any other desire to do anything different. Maybe like business school, because there's so much in veterinary medicine that's business oriented that we just don't learn. They're implementing more business classes, probably a very small amount, but in vet programs these days, but there was 0 when I was there. So that would be maybe interesting, but more so would just be to specialize and
learn more stuff. Yeah, I know. I can hear it. Trust me. I know your world. I know at least this part of you. That's for certain. I'm 100%. But can we shift gears for a second to something you said back in the first couple of minutes?
Sure.
Talked about I think you were alluding to things have been tougher management wise for your daughter since hormones. Does that seem like where you were headed? What are you seeing? Is it just generally blood sugars that are just generally higher than normal, worse spikes? The regularity of it?
Yeah, all the above. Higher blood sugars, irregularities. And honestly, I would say the biggest problem is just she's 14 and she doesn't want to be bothered. Okay. And she's not total like Debbie Downer about diabetes. She actually, more days than not, admits that she kind of enjoys it. She has like tons of awesome friends. She loves camp. She's proud of her hard work on it. She loves the tight relationship she and I have. We're a team, but can I bother her to like pre-bolus for a meal? Oh, it's the end of the world. If I'm not there to nag her, she's at a friend's house or at her dad's house or whatever, all of a sudden she's 350. I text her, did you eat? Did you bolus? Oh, no, I forgot. So I think it's hormones and just what that does to all endocrinology is complex. Yeah. Everything works together. So how it's affecting everything, but also just the teenage blasé attitude of, whatever, I'll be fine, Mom.
Yeah.
Yeah, my A1C is 8.2, but it doesn't matter. It's fine.
Oh. And you're like, no, it's not.
It's not fine. You're killing yourself.
I got a schnauzer named Butch living better than you over here. This is not okay.
Right?
Do you take A1Cs from pets? How do you know you're doing okay? Just because it's alive?
So, yeah, we question and monitor. So the best test we do is fructosamine for dogs and cats. Okay. Checks, like I tell owners, it's a lot like A1C because so many owners are familiar with that, and it just gives us the 2 to 3 week average, basically. And I question them, do they drink a lot? Do they pee a lot? Are they maintaining their weight? Just stuff like that. And if they're happy and perky and fructosamine's acceptable, we check it off as a win.
How do you, do their lives get shortened? Is there any way to know if they're losing a little off the end or?
Yeah, I mean, statistically, they kind of do. Mm-hmm. Yeah.
Okay.
Just because I don't think we can regulate them as well as hopefully most of us are on the human side, unless you have a 14-year-old stubborn girl. But I think their lifespans are shortened. I would say so.
Okay.
Just it takes its toll on the body for sure.
Can you kennel a dog that has like I'm trying to imagine, like, how do I go on vacation if my dog has diabetes? Like, will a kennel give injections? Some of them, maybe.
Typical kennels won't. So in our area, we have a couple like pet sitting services that have registered techs on staff, and they can do, home visits. We do medical boarding. We don't do regular boarding, but any of our clients that have intense cases like seizure dogs or diabetics, we'll do medical boarding and manage them there. But then that implements a whole other problem of the eating. A lot of the dogs and cats don't want to eat well when they're there. The stress is changing their numbers. And, so it's hard for a
It's diabetic. Exactly the same for a dog or a cat as it is for a person.
Yeah. So it's hard on the owners. Yeah. There's some owners that have like an amazing neighbor who can give shots or, whatever. There's creative ways to go about it, but it's hard. It ties them down for sure. And then you want them to be pretty close to 12 hours apart, which how many of us are home exactly 12 hours apart every day of our lives?
Yeah. Yeah. Right. Hey, can dogs do inhalers?
No. Okay. Well, I have not heard of any inhaled insulin going for dogs yet.
Okay.
We do inhalers for asthma in cats. So I've not actually thought of that. I wonder if it'll evolve to be a cat treatment or even a dog treatment. But as of right now, this is the first I've ever thought of that or heard of it.
No, I just was sitting here thinking if somebody can make it happen, it might be you. And I didn't physically understand if like a animal could do an inhaler, because like, the idea of an inhaler is, to push the button and then breathe in.
Yeah. So we have those chambers. For us, they're called arrow cats. And I don't know what they're called on the human side, but I know like my son had one he had like temporary asthma when he was younger. And those little tubular chambers with that little rubber mask at the end.
I see.
So when we use like Flovent or something for asthma for cats, dogs don't tend to get asthma. So I have never used an inhaler on a dog, but cats, we just kind of hold that little mask up shake it up and hold their little and push the little plunger and let them take 4 or 5 breaths and they're done. So I don't know.
Let me put this right here just in case. If anybody out there ever finds themselves giving their cat or dog a Frezza, I did it. Okay. I made it happen because this might be years from now. It might take a while for my idea to get through the mainstream. But I'm taking credit for this right now, March 31st, 2021.
It's an interesting idea. Now I'm going to have to look into it.
I swear, if this ends up happening, I would like a procedure named after me. You and I can get together and decide on the name later.
All right.
Yeah. So what do you do? I know this is going all over the place, but I'm having a good time. By the way, thank you for being chatty. I think I could have started this off and gone, hey, everyone, this is Kari. She's a vet and her kid's got diabetes. And then I could have maybe left the room and come back because you are so good at this. So thank you.
Thanks.
Yeah, no, please. So now I'm gleaning from our conversation that you have like a split, your daughter, your kids go back and forth between 2 households. Are they with you more than they are in the other place or vice versa?
Yeah, they're with me maybe like 3/4, 2/3, 3/4.
Okay.
Yeah.
So that presents its own management issues, I would imagine, right? Because you don't think about diabetes. I mean, nobody thinks about it exactly the same way. So I'm imagining your ex and you don't have the same ideas about it.
Yeah.
Okay.
That's a good point.
That's a good point. Sorry. I don't want to get you into a fight on a podcast, but okay. And so I've done episodes about divorce and diabetes, and they're you got to find the exact right person to want to talk about it. And I did once, actually. A guy came on, he was terrific, and his ex-wife said he could talk about it and everything. He was so like good about it. But the point is that he had one management style, and then his ex did not have the same understanding of it. And so I'm wondering when a child's already kind of like, I'm not all that interested in this. Does one household make that easier than the other? And then does that put you in a weird position where you want to say something, but you feel like it's not your place, but you know it is?
Yeah, absolutely. And luckily, my kids didn't have to split households till like a year ago. So, if she was 7 or 8, and I think it'd be super hard. But, but I mean, she has her phone. She knows it better than him. I hope he never listens to this, but she knows the whole disease and everything she needs to do better than him. She knows how to change her pump site or CGM better than him. Mm-hmm. So I kind of just work directly through her while she's over there. Yeah. And once in a while, I've had some issues where I can't reach her or this or that. I have to reach out to him. And, he says he's on it, but, humans have different opinions of
what on it is, right?
But yeah, luckily, again, she's a trooper. Even though she doesn't want to be bothered a lot of the time, she accepts at this point her diagnosis and her need to take care of herself. And so she and I are very tight and very good together. So I just work directly through her for the most part. But yeah, her numbers are not usually as good over there, but I got to pick my battles.
Aside of the pick the battles vibe, are you heartbroken while it's happening? Like, how do you deal with it? Because if you told me right now that I couldn't text my daughter and tell her that her blood sugar was 139 and I wanted it to be 85, then I would have, I believe what they call agina the entire time. Does it bother you?
Yeah, it does. Yeah. But I also have to just kind of choose to let some stuff go. There was one time a couple weeks ago, I was just infuriated. She was over 400 for 6 hours. Oh and gosh, yeah. I couldn't reach her, or she was with the girlfriend, and she hates being around her, and she doesn't want to talk to her. And she didn't want to answer the phone because she didn't want to talk to me in front of her, blah, blah, blah. It's just this whole ordeal. So her dad and I don't talk a lot,
Mm-hmm.
but I did end up reaching out. We use a court-ordered app, our Family Wizard. I reached out through that, and I kind of was pretty straightforward. I'm like, this is unacceptable. She needs to do this. She needs to do that. And he's like, oh, well, I just now, after I reached out to him, just checked ketones. She's fine. She feels fine. She forgot to dose her cereal this morning. We've been chasing the numbers ever since. This was 6.5 hours later.
Yeah.
I'm like, you don't chase a missed bowl of cereal for 6.5 hours.
I don't want to misrepresent why you're here. But you just said something now. I have to tell you, I'd stop this recording right now and then say the words to you, court-ordered app, and then let you talk for an hour, because I really would love to understand what that is. More importantly, I'd love to hear the story about how you got to it, but that's neither here nor there. So we're not doing that. But I'm imagining something that when you look back on, you both cringe and laugh. That's all I'm saying.
Well, I cringe and laugh. He probably cringes and
doesn't laugh.
has anger. But
I gotcha. My God. It's crazy.
Yeah, a whole other story.
Yeah, that's not why you're here. But you fascinated me when you used the words court-ordered app. I was like, oh my God, there's such a story behind that.
Yeah.
Don't tell me. Tease the people.
It's been a rough road.
I'm sorry.
Bitter or better.
No, I am super sorry to hear it. I grew up like, in a divorced house, and I understand all the serious parts of it. And I don't understand. I do want to ask you this one question. You don't have to elaborate, but if you're comfortable answering, do you think the diabetes make it harder to be married?
Yes. So that is a great question. I love to analyze and, think about stuff. So I would never want my daughter to feel this way, but I feel, big battles in our lives either bring us closer or break us up. And I felt, with her and me, and even my son, he's an amazing support for her and he adores her. I mean, it's strengthened the family significantly. And my ex for the first year was all on board. And I mean, we were a team of 4. We battled this. We're doing great. He has a history of mental illness and stuff like that. After about a year, he just kind of tanked. And I feel it led to a lot of troubles within himself and within us. And it just went downhill from there. So yeah, unfortunately, I think that first year, it was just this almost a weird blessing. I don't want to call it that, but it was, we were tight and nothing would stop us. And we were upbeat. We weren't one of those families that, just kind of break down in tears every day about this. We were like, we got this. Yeah. We can do it. We're going to do it good. I immediately got involved with JDRF, and that's progressed to the point of like a seat on the board. And, my daughter and I do tons of advocacy, and it's become like a new way of life. And for her and me, we've stuck to it, but it spiraled for him. And I think that affected his mental well-being and our marriage and everything.
Yeah, I'm sorry. Is there autoimmune on either your side of the family or his?
Yes. So no type 1s. Well, there were no type 1s. I have 2 or 3 autoimmune conditions, celiac, and then a rare one called polymyositis, and then little stuff like Raynaud's and eczema and stuff like that. My mom had scleroderma. My aunt had lupus and Crohn's. Tons of autoimmune. And my daughter was diagnosed with hypothyroid at the same time as diabetes. And she doesn't know it, but her blood work last week showed a high celiac antibody.
Oh my gosh.
So I have to deal with that. But, and then her dad's side had none, but interestingly enough, a young child was diagnosed on his side, and it is his half sister's granddaughter. So I don't know if there's some genetic stuff there, but she was diagnosed within the year this year. So I don't know if there's any sort of link there, but
the reason I asked initially is because I'm starting to get a larger number of people who come on to talk about that they have type 1 and they're bipolar. And it started making me wonder if bipolar was autoimmune. And there are some writings that seem to feel like it may be. And I thought I was so interested by that when you said that. But
interesting. Yeah. Well, that could relate to her father.
So I just was like,
it's all his fault. She has it.
Finally, we've proven it. But do you come from like an Irish background ish? Do you have a lot of that?
No, I'm Swedish and German. He's a mix of everything.
Type 1's is Sweden one of those places where it barely exists or where it's prevalent? I'm looking.
Good question, but I feel like it's low.
Most common chronic diseases affect children. Yeah, type 1 diabetes is one of the most common chronic diseases that affect children in Sweden.
Oh, really? Yeah. Oh, good to know.
I after you talk to enough people about this over and over again, you just start seeing connections. Like certain backgrounds, certain places on the globe. Like it just, like that you've got a number of autoimmune and that your daughter might have celiac. Does she show any symptoms?
No. So interestingly enough, they screen her once or twice a year for all that stuff. She had one of the antibody levels was high, 3 or 4 years ago. And it was kind of a rough patch of time as a family. And I was also switching her pump. I think that's when we went from Animas to Medtronic, and she was relatively young and she wasn't symptomatic. And I talked to her doctor. I'm like, can we get over this hurdle of the pump and just take a few months to kind of settle back down, and then we'll address it? She said, sure. So by the time we got around to considering scoping her, she's like, you know what? Let's run blood work again, and her values are normal.
Okay.
So we never scoped. Yeah. But I feel like she's been on that trajectory. I'm an optimistic person, but I'm a realist. Mm-hmm. And I kind of, in the back of my mind, she's just been on that trajectory and it's coming.
Yeah.
And so, I haven't heard from the doctor yet about the blood results, but they post online, and I thought, oh no, here we are again.
Pretty soon.
And I haven't told her.
Yeah, I would think that's not going to be fun. I've had to tell my kids a number of medical things, and it's heartbreaking leading up to it. And then you got to be that cheerleader and help them get through it the whole way. And it takes months for it to sit in, and it's hard to talk yourself into. I kind of
feel, and maybe grass is greener. I don't know. I have celiac, like I said. I would rather have type 1 than celiac.
Oh, you miss pizza that much?
I can handle a needle. I can handle carb counts. And granted, I'm not living it like she is. So that's probably a very flippant thing to say. But, the celiac, I'm so ultra sensitive. And she is such a picky eater, It's going to be super rough if she has to go gluten-free. And I don't know.
Well, I have a number of episodes with people who really leaned into it and did a great job with it, and would now tell you it doesn't impact their life in any of the ways that you're scared of. So
the celiac stuff.
Yeah, it's doable, I guess.
I mean, I don't know. I mean, I'm not one of those celiacs that are afraid to eat out or anything, but I am really leery because I'll have them flag my meal and I'll still get sick. And, it makes it kind of difficult to work or difficult to leave the house or, it's just, I hate the unknown and
No, I can't imagine, but I do think I understand what you're saying. Like the idea, at some point you might just take a bite of something that throws your days off, not just a couple of hours, right? But for a stretch of time. And,
I mean, I get crazy sick and I can't even pinpoint where, but I know it's gluten because I feel a certain way for gluten exposure. And it doesn't have to be one time early on, I kind of forgot I was cooking hamburgers on the grill for the kids and all their friends. And, next thing I know, I had eaten a hamburger on a bun. And I'm like, oh my gosh, what the heck am I doing? I didn't get out my buns. Or I'm like, I was so sick. But I mean, that was a big exposure, but just small stuff. Like, I can tell when it's gluten exposure versus just, little flu or a little, too much coffee or, whatever. And it's unexpected and it's frequent, and so I just dread with her picky eating and her social life and her.
Well, does she see? I mean, she obviously sees you live this way. Does it look burdensome to her through your eyes?
It does, but she's super supportive. Like if I make something gluten-free, I don't have a gluten-free household. I feed them and me separately sometimes. Mm-hmm. But if I make something gluten-free, she wants to try it. She never likes it, but so she's very supportive. She thinks it's unfortunate, but I think she feeds off of my, I'm not one to like, woe is me, I'm gonna have a pity party and my life sucks. And so I think she realizes it's just another burden in life, and what doesn't break us makes us stronger. And I remind her that I'm healthier for being gluten-free because that's what I need. And, she's okay with it. But yeah, it'd be a whole other story if it's her.
Yeah. All of a sudden she's like, listen, I know we were rah-rah on you, but for me, boo-hoo. Like I would feel that way, I think anybody feels that way when something is kind of quote unquote taken from them. But, it sucks that you've got the experience that you're not having a great time of the celiac. So it's not like, you know what I mean? It's not like you're like, oh, I've got it all straight and it works great and I never get sick. And I'm sure it happens to everybody. And she's seen that. Yeah. You're right. She's not going to have a great reaction. I do not, I'm sorry for you that you're going to have to give her that news.
Yeah. I mean, we'll see. It was mildly elevated and just one value, but I just, gosh, this poor girl.
I understand. I really do. It sucks. I have to tell you, I really appreciate this. I did not know how this was going to go. But I just want to ask you just a couple of drill down questions at the end so that people who dogs one more time, like what would people notice in their pets that would make them feel like they have diabetes?
So pretty similar. I mean, lots of thirst, accents in the house, sometimes vomiting, definite weight loss. So all the kind of the same things, really.
Okay.
Lethargic. Yeah. Okay. Same stuff.
All right. And then they go to you and say, I'm seeing what looks like diabetes. You do a quick test, I guess, and then they're on their way.
Yeah. So for most of these people, diabetes isn't on the radar. They're just like, hey, it doesn't feel good. He's been laying around. And then a lot of times they don't mention that they're drinking like crazy, but I have my list of questions for every sick patient, like how, water consumption up or down, any vomiting, and I check a weight, and I almost always know. I mean, there's a distinct difference between, say, a cat and kidney failure and a diabetic cat. Like there's just a drastic difference, but similarity. They both drink more.
Right.
So I tell them, well, I usually do a full blood panel. We run it in house. We have results in half an hour. I'm like, I'd like to check the kidneys and the blood sugar and some other stuff. Let's see what's going on. And, there it is.
Cool. Well, I really appreciate this. I'm going to say thank you and stop. And then I have something I'm going to tell you personally that I think your daughter might like that comes through the podcast. So I'm not going to bother the people listening because they already know. But I want you to know, and you can do whatever you want with it. So thank you very, very much for doing this. It was delightful. No, I appreciate pleasure. It. You were very flexible with time and everything, and I appreciate that very much.
Sure. Yep. No problem.
All right. A huge thanks to Kari. Kari, what am I doing? Kari. Jesus, this is what happens when you let me do this late at night. A huge thanks to Kari for coming on the... Kari, I did it again. A huge thanks to Kari. Kari. A huge thanks to Kari. Kari. What the A huge thanks to, how do you sell? Oh my God, I just talked myself out of saying her name. A huge thanks to Kari. I don't even know. Forget it. I give up. I could go back and listen to her say it again. It might be something to do with her Midwest accent. I can't tell you, but one way or the other, I really appreciate her coming on, and it's late at night, so cut me a break. A huge thank you to one of today's sponsors, Gvoke Glucagon. Find out more about Gvoke HypoPen at gvokeglucagon.com/juicebox. You spell that GVOKEGLUCAGON.com/juicebox. I'd also like to thank the Contour Next One blood glucose meter. I know it's not really a person. I can't thank the meter, but it's the Contour Next One blood glucose meter. That's what you're supposed to know about, but it's made by Ascensia. So if I was really thanking somebody, I'd be like, I'd like to thank Ascensia. Then you'd be like, who in the hell is Ascensia, Scott? Which is why I just say, I'd like to thank the Contour Next One blood glucose meter. Check out those second chance test strips. By the way, the meter itself, it might actually be cheaper to buy in cash than other meters are through your insurance. That's like another thing you can find out on that website. The website rocks. contournext.com/juicebox. Head over and take a look around. While making the ads for this episode, I learned about myself that if you come on the podcast and say to me, hey, Scott, tell me what you think about people who scam people on Facebook and try to get them to buy t-shirts, I could probably rant and rave about it for about 40 minutes, which I didn't know until just now. I'm assuming you know. You were like, oh yeah, that's not surprising to me, Scott. But to me, it was surprising. I was like, I have a lot of feelings about this. Yeah, right. That's pretty much it. See ya.